Now, there are some things that you need to look at in understanding HIV. There's the virus and there's the human, but I prefer to call it the host, because the family from which this particular virus that we are looking at comes from does also have other hosts. But we are looking at this particular virus which is going to affect us humans as a host. All right. To understand what is happening with HIV, we need to look at a few things. Something about its epidemiology. Something about what's the natural history of an infection. How to evaluate. Which has both laboratory and the clinical. Then comes a huge thing called management. There are many segments in it. There's clinical management, there's social and family management, there's government management, and there is another part of the management which is very necessary, because we are not just talking about the body, we are talking about the human as a soul. So there is a counseling management that is necessary. As part of all this, there is a need to develop networks and linkages. So you can see from this, it's no more a situation of patient came to your clinic, you took some data, you came to some conclusion, you gave some advice, and tata bye bye, thank you very much. No. This story is going to keep coming back again and again to haunt you, unless you are very clear that you are going to have a very wide, broad perspective, if not you're directly involving yourself, but getting the patient and yourself connected to these. The reason is that the requirements of care for an HIV person are so vast that most of the time it's not possible or it's not appropriate for only one therapist or one caretaker to complete all the requirements. There will be a whole team required. So such a team usually requires a primary physician. This person is going to be, it's something like a general practitioner or a family physician. This person is going to be the link person for all the requirements. There will be a nurse or some sort of, practitioner of some type. There will be laboratories. There will be consultants. There will be social workers. They're all part of it. And one very important portion, there will be counselors and definitely a nutritionist. This is the minimum. Now there will be some link agencies, for example, in the government who will also be part of the team. That usually is going to come out of the social welfare department. They are going to be the link persons that you have to wind up with. So normally these two are the people who the patient will be mostly connecting with. The next will be social worker, counselor, consultant. The lab will be the resource where which all monitoring periodic follow-ups will have some sort of a standard set. So these are the main things. For a good primary health and long-term maintenance of health, timely nutritional assessment, nutritional planning, and nutritional therapy will have to be included. Okay, so now let's look at some important things. Who is affected? There is a virus, there is a host, and there has to be some way that the two can meet. So routes of transmission for this virus are, now the next thing is, who has been practicing less than 5 years, less than 10 years? Okay, so the reason why I'm asking is twofold. You either have got to have a very big practice, or you're really intensely involved with your practice before you find out that when you start caring for people, you're never caring for one person alone. You're always caring for a group. That one person is connected with a group, and the interactions of your patient with the group invariably come back to you as a clinical problem. They invariably, at some level or the other. So if you've been practicing more than 5 years, you probably would have got used to this idea. So therefore, you'll have to know that when you're dealing with HIV patients, you will never deal with only that patient. At some point in time, you'll be dealing with others also. The next thing is that if you've been practicing more than 5 years, you probably would have come to some sort of an idea that even though there is only one very clear-cut presentation of a problem for the patient, there are a whole lot of other things that add to the misery, or add to the diagnostic dilemmas, or add to the management dilemmas for that particular problem. These are usually what we call constitutional considerations. So you have got used to handling constitutional illness apart from a specific illness. The third important thing is that if you've been practicing more than 5 years, by now you would have developed your own professional network of so many other agencies which I listed in the team. So you already have an idea of who all to connect with when you need some help in caring. So these are usually the things that beginners in HIV care find a little difficult, because they got the patient, okay, they identified that this is an HIV patient, and then they're thinking like, abhi kya kare bhai? Can I handle it? Can I manage it? What should I do? Who should I contact? When should I check up next? All these sort of dilemmas start coming up. So part of the ideas behind this presentation is to be able to include all of these. I've been given to understand that some of you are, very few of you are from Bombay and most are from out of Bombay. Is that right? Or all of you are from Mumbai? Who's from out of Mumbai? Where?
I'm coming from Calcutta.
Calcutta.
Surat.
Surat.
Satara.
Satara. Satara is very important to me, because my involvement, at least at a community level, came from the fact that out of about 230 doctors in Satara district, not more than 2 had any training in HIV management before they started prescribing medicines for it. People were doing all sorts of crazy things, and there was this huge influx of patients with complicated management issues, and the only answer for it was to train doctors. So all of them were contacted, connected with, and trained over a 1-year period, that they all were given intensive training in primary care. And it is amazing how the epidemiological demograph for that area completely changed. So a core issue obviously is good capacitation of professionals. That's obviously something that has been learnt. Okay, anyway, getting back to routes of transmission. This is one virus which cannot live independently. It does not tolerate bad weather. And it is susceptible to most chemicals which will adversely affect any structure which is used for creating a cell wall. Any type of chemical, it can be affected if it is met with outside human tissue. So it's a fragile virus.